From the nonpartisan Maddy Institute and the California channel at the state capitol, this is a Maddy Policy Brief. Recently, the Nonpartisan Legislative Analyst's Office warned that the state's most significant long-term liability is what it owes for state employee retiree health benefits. Our guest, Nick Schroeder, is the LEO's expert on state employee issues and here's to explain some of the essentials of the state employee retirement health benefits, what it means for state workers, what it means for the state budget. Welcome, Nick.
Thank you.
So, can you briefly explain how health benefits are currently provided to retired state workers? How does it work?
Sure. So the state provides both active and retired state employees health benefits. And the health plans that are available to active and retired state employees are the same plans, and they're administered by Calpers. And the only difference between active and retiree health care is the amount of money that the state spends towards their premium costs. For a typical active employee, the state pays about 80% of the premium costs. But for the typical retiree, the state will spend 100% of the average premium cost. So in dollar...
A lot of running to the doors to retire to get the 100% benefit.
So in dollar sense, for the active employee, it's about $1,000 a month. That is typical for the state's contribution. That's assuming that it's a employee and one dependent. That could be either a spouse or a child.
So it's even more expensive for retirees.
Yeah, for retirees, it's about $1,200 a month.
Okay, so is this a promised benefit that's guaranteed for life?
That's really, there's some ambiguity as to whether or not it's a guaranteed benefit or not. It's something that the courts really need to decide how this benefit is constructed under federal and state contract law.
Okay, so it's up to the courts, I guess. So there are some people that do think it is a guaranteed for life benefit. Other people say it's just like any other contract that could possibly be.
Yeah, we're not certain. We think that it's still unresolved.
Okay.
The one thing that is certain is that there is no guarantee for future employees. So the state could change the benefit or even eliminate it.
So you could have two employees working, one with the benefit and one that doesn't have the benefit. Yeah.
Depending on date of hire.
Right.
Yeah.
Okay, so retiree medical health care costs. I'm just wondering, what's the likely trajectory if nothing is done?
So since we're doing a pay-as-you-go model right now, the costs really are just dependent on health premium costs and the number of retirees that are receiving the benefit. And so over the past 15 years, the state's costs have nearly tripled. And that's because of health premiums growing, and that's really just a national trend of health costs growing. And then also the number of retirees has increased, and that's because people are living longer for the most part.
And also the baby boom generation is kind of moving through the workforce as well. So we're talking about the pay-as-you-go system. Has any money, though, been set aside to pay these benefits long-term? And what is the actuarial calculation of the outstanding liability?
So virtually no money has been set aside.
You said virtually, which means probably a little bit.
There's less, by the end of the next fiscal year, there's estimated to be less than $200 million saved up. And that's because the state has started pre-funding for 3 bargaining units. And the unfunded liability by the SCO's calculation is about $72 billion.
So 200 million sounds like a lot, but when you compare it to 72 billion.
Right, it's very small. Virtually nothing's been set aside.
Yeah, it's hard to refer to 200 million as chump change, but in this issue it kind of is. So we've got this current pay-as-you-go system, and there's also something called a prefunding model. Could you explain the difference? What are the advantages and disadvantages of each?
Yeah, sure. So to explain this, I'd like to use an example of a hypothetical employee, John. So let's say he's worked for the state for 20 years, and he's retiring in the 21st year. So each of those 20 years, the state has promised that they're going to provide him health benefits for both he and his wife in retirement. Over those 20 years, the state hasn't put any money aside to pay for that benefit. Instead, the state's going to pay for that cost after he's actually retired, and the state will have to find about $14,000 to pay those benefits. Under a pre-funding, what would happen is that in those 20 years, each year the state would put money aside, and it would be invested in a trust fund, and after he retires in the 21st year, the money in the trust fund would be used to pay that benefit. And so the state's costs after he retires would only increase if there was a shortfall in that trust fund. And
typically they use that method for pensions.
Right.
And that pays a large share of the pension costs, correct?
Yeah, so if you look at the Calper's model for pensions, about 2/3 of the benefit payment is actually from investment gains.
So this is very much a pay me now or pay me later, but it's going to be less expensive long term if you pay me now because you can use then the interest on that money to pay off the obligation in the future. Is that basically how it works?
Yeah, that's exactly right.
And you also mentioned that the cost, because they're using this pay-as-you-go system right now, has tripled. And my recollection of reading some of your work is was about 500 million?
Yeah, it was about 500 million, and it's now, well, the in the next year, it's going to be about $2 billion for retiree health benefits.
Yeah, so that's quite a jump.
Yeah.
What I was reading was 500 million to 1.5 billion, but
Yeah.
a few hundred million here or there. It's big numbers.
Yeah.
So what is it going to cost to address the current unfunded liability over 30 years if we're trying to retire that debt?
So based on the same SCO actuarial report that the $72 billion
And
is
SCO stands for?
the State Controller's Office.
Okay.
So each year they produce an actuarial valuation that looks at this. And according to that report, if we were to start paying, so we'd start pre-funding benefits that employees earn each year, and also to start retiring the unfunded liability, we'd have to put away $4 billion in 2015-16.
Okay. Well, thank you. For a more in-depth analysis of this and other public policy issues important to Californians, please log on to our website at maddyinstitute.org and click on the Policy Analysis tab.